Hi to all the viewers. So, today I'm very happy to present before you the proud achiever of All India rank 24 in the recently conducted NEET SS 2023 exam, Dr. Vikram Jain, who had secured an astounding rank of rank number 24 in the national level. So, warm welcome and hearty congratulations to you, Dr. Vikram Jain.
Thank you so much, sir. Thanks for having me. Thank you.
So how do you feel now? Did you expect this rank?
Yeah, sir. Actually, I was not expecting because I was scoring around this rank only in GTs. So I was not expecting because we don't know what kind of paper it will be there in NEET SS because they used to change each and every year. So that's why. But I was confident enough that I'll get rank in top 100 and I'll get the branch of my dream. That's why I was confident about that.
See, right at the start of the interview itself, Dr. Vikram has underlined a very important point because of the confidence with which he has approached the final exam. I think you have given almost all the GTs, right? And you were getting
Yes.
almost around the same rank which he eventually got in the final examination that matters. So, that again, as the saying goes, practice makes the man perfect. So, he gained all that confidence by his consistent performance, giving all the GTs and securing a constant amount of marks. So the ranks may vary according to the examination, to the students, according to the students who are giving, the more number of students who are giving the exam, the more level your ranks may get. But if you are able to score consistently in the GT, that will definitely boost your confidence. I think that is exactly what has happened with Dr. Vikram. So before we move more into your preparation, can you give us a short introduction from where you are from, where you have done your undergraduate and your post graduation in medicine?
Sure, sir. I'm you have stated, I'm Dr. Vikram Jain, and I reside in Udaipur, Rajasthan. I'm from Udaipur, Rajasthan, and I did my UG from R&T Medical College, Udaipur, Rajasthan, and then I joined AIMS Rishikesh as MD medicine resident, and I just finished my MD medicine in this July, August month only. Then I have appeared for this exam of NEET SS, and I have now I'm talking to you, sir.
Yeah. So again, now for the last 2 years, when they have switched the pattern for NEET assess from a specialty oriented to a medicine broad specialty based entrance, I think more and more freshers are now coming up with good, very high ranks because they are fresh from their medicine learning. Rather than in the previous years when we used to see the 1 year repeaters were having more of an edge over the freshers. So I'm not very sure everyone would agree whether it is a welcome change or not. That's a question for another day. But Dr. Vikram, when did you seriously start preparing for this NEET assess, aiming precisely for this entrance examination?
Sir, to be honest, I've we have finished our exam I think in April or May. So after about 1 month of gap, then I started going to library and then I started preparing it seriously. But since then, I think it is about 2 or 3 months that we were preparing as a group, not as a group. We are 2 or 3 people only together. So we are preparing seriously for this NEET exam. But before that as well, I wouldn't say that I prepared for last 3 months only because for my entire MD residency, we were studying Harrison and some other topics, guidelines, and up to date as well. So we were preparing for this exam since very long time. But on a serious note, just for the MCQ purpose, we were preparing for 2 to 3 months only. Sir.
Very important point. I think Dr. Vikram Jain has himself emphasized the point. Even though he has said that he has seriously prepared for the last 3 months, I think this such huge achievement doesn't come overnight. It is the months and years of hard work which has accumulated and has finally yielded the result. So he has been preparing from Harrison for his enhancement of knowledge of medicine, and which has finally helped him in cracking this NEET exam. So, so how did doc tutorials as a platform help you in shaping up your preparation for the exam?
Sir, yes, sir. So I took dog tutorial particularly because of endocrinology purpose because I've heard a lot about you, sir, and your videos, that they are very excellent, and they are quite productive. So I saw all of your videos, sir, and then I prepared for NEET SS particularly from the QRP videos. And then along with that, I started giving GTs, grand test, for this NEET SS only, and that's how I utilized Dr. Tural. Most importantly, it was about endocrinology, your videos, and plus the QRP sessions of all medicine.
Yeah, I think without asking itself, Dr. Vikram Jain has highlighted all those important packages that we are offering, especially the QRP, which we had released last year itself. I think even though I think Dr. Vikram would also agree that though he had read medicine over the last 3 years, revising it over a span of say 2 weeks or 1 month is a very tedious task. I do you agree, Vikram Jain, that QRP has helped you in revising and going through all the important topics and retrospectively reading Harrison?
Yes, sir. They were quite helpful, and the most important thing is you have to solve MCQ in the exam. You don't have to go line by line, and you don't have to read entire Harrison again and again, again and again. So that's what I learned from QRP sessions and from your videos, that it is all about all those four options. It does not go beyond that. It You have to mark among those four options, and you will get rank or marks after that.
Yeah, very, very, very important point, because students are always confused that the NEET assess you have 150 questions. Many a time the question come from rather few areas which you deem as unimportant. For example, cardiac sarcoidosis has two questions this time that students usually don't expect. But even in those questions, it is not mandatory that you have to answer that without seeing the options. You can easily rule out two or even three options by looking at the question itself. The question would give you an hint, and if you have an overall knowledge, it is not mandatory that you should memorize all the lines in Harrison. So if you have an overall knowledge and hey, like a knack in ruling out options, you can easily crack that question, is what I felt talking to so many students, because even though they have not read about the topic, so like very so many examples are there in this exam. The straight back syndrome question, the teratogenicity of benzodiazepines. When you look at the feasibility of other options being the answer, you will be able to rule out certain options. I think Dr. Vikram would also agree, right? You must have got so many questions
Sure, sir.
correct. Yeah.
Yes, sir. Yes, sir.
So, Dr. Vikram, how many questions did you get correct eventually from in the exam, and how did you rate the overall exam? You must have given so many entrance examinations in the future also. How would you rate that difficulty of the exam?
Yes, sir. After giving the exam, first of all, I felt it was a relief that I may not have to give one more or one or two more of this MCQ or a NEET pattern exam, because they are quite frustrating at at one or other point of time. And I attempted 142 questions, and I felt like I should have attempted more, but at that point of time, just because of some time was there, and 1 or 2 hour delay and each and everything, so I attempted 142, and I got 118 corrected. And among those, I think I made two or three silly mistakes, from which matlab, when I came to home and I realized that I should have marked this and that. That happens in usual exam. And the overall pattern of exam, it was quite similar to the previous NEET pattern exam that happened in 2022. The main point of difference was, according to me, what I felt is the questions were a bit tricky at one point of time. You can't just rely on Harrison, and you can't just read the textbook, and you come and give the exam. You just have to apply your MCQ, the MCQ mind that is there in your brain, because we have given a lot of MCQ exams. So just we need to rule out two or three points, and we can solve those questions. As you have also stated in your sir analysis video, that the level of difficulty, the moderate level of difficulty in this paper, there were more questions of that type. So that's what I felt after giving the exam. Yes, sir.
And regarding the question type, so many students are asking me, like, how will the next exam be? Will it have more of one-liners? Will it have more of clinical questions? So what I felt from the student recollection of questions this time is that even though there are more number of clinical questions, like say 50 or 60, but many of them would be stressing on a single point. So even you can extrapolate them as extended one-liners. Do you agree, Dr. Vikram?
Yes, sir. It was quite typical of NB NEET pattern exam, which was they will give you they will give you entire history. Just like one question was there about cobra poisoning or OP poisoning, which I unfortunately I corrected that. I have not corrected that question. It was one of the silly mistakes because they will give you such kind of question, and one or two points will be there in question. You don't have to read entire question, and from that point only you can rule out three options, and you can mark one option correct. It was a typical NEET pattern exam as usual. And regarding one liner, there were so many one liners in this exam, and it was not directly one liner like most common cause, least common cause, etc., etc. But fortunately they were asking about the same question only, that you have already read in your whether in your notes or in after doing the GTs or doing questions in the app as well. So they were a bit like that only, sir.
Yeah. So how did the mock exams? Because we have conducted a record number of grant tests this time, around 17 or 18 grant tests, which is almost 3 to 4 times higher than any of the other apps offering the same course. So how did this mock test and the level of questions mimic the actual exam?
Sir, the main my focus mainly on about after giving mock test was that I have to they were quite simulation of the exam. Like you have to sit there for approximately 150 minutes, and you will get 150 minutes. You will get 150 questions, and the level of difficulty was also moderate level among the mock test as well. Of course, we can't predict how NEET SS will going to be this year, and how what will be the pattern of NEET SS. But what I like about mock test is they simulate what you read in Harrison. So each and every point of Harrison is covered in the mock test, and those things which you don't emphasize while reading Harrison, or even while some things which are not in the QRP sessions as well, those will be covered in the mock test also. And the explanation of the questions were also there, and they were also pretty straightforward from the Harrison. So of course the one gold standard textbook for us MD medicine is Harrison only. So mock test have pretty much covered almost each and every point of Harrison, which is essential for the NEET SS exam. Not each and every point which is not essential.
Yeah, actually, there are so many take-home points for the aspirants which Dr. Vikram is giving out, and many students and many other people have asked us, why are we doing so much interviews? Why can't you restrict the interviews to the top 25 or top 50 rankers alone? Why are we extending that? Actually, what I believe is that those who are able to secure this much great rank in their first attempt itself, like Dr. Vikram has done here with rank number 24 in his very first attempt at NEET, would have got the same rank even without the help of these platforms. That is what I believe. Because some people have inherent ability, or they have been trained in such a way that even if they don't know the exact answer, they would be able to extract the answer from the options. So they have that knack of solving MCQs. That may not be the case for all the students. So what the aspirant should do is that you should not try copy and simulate what the rank 1, rank 2, or rank 5 has achieved during his preparation. You should go through the interviews. You should hear all what the toppers are talking about, their modes of preparation, and you should find and choose what works for you. So here Dr. Vikram has specified that he has not dedicated his preparation for a long period of time just for NEET SS. He has read Harrison throughout his course, and he has given the last 3 months. This may not be working for everyone. Some may have to give a specific or dedicated time, say 6 months or 8 months for Harrison preparing, especially for NEET assess. Likewise, some people are hesitant to give the GTs. They would give GTs during the fag and nearing to the exam, all of a sudden, rather than giving it at a time. So it works differently for different people. So you should hear what they are saying and you should find out what best suits for you. So finally, you have got a great rank in this exam. You have all the options opened ahead of you. So you've already mentioned that endocrinology is the one that you like. Do you still want to pursue endocrinology as your career option?
Yes, sir. I am assured that I want to pursue my I want to spend my rest of the life with endocrinology as a branch only, and because the reason for that is uh, actually I like medicine only. There is no I don't know how I can differentiate between different branches because they all are part of medicine only. But the one point about endocrinology is it involves the all the organs uh, of the body, and it is quite interesting in reading and treating the patient. That's why I want to pursue my rest of the career in endocrinology, sir.
Any specific college in your mind where you want to join? Or you still want to
Sir,
give INI and let's see how it goes?
yes, sir. That's what I'm thinking right now, because I have not made any inquiry about any specific college. So, since INI is about 10 or 12 days later only, so let's see what happens in INI, and then I'll talk to you only about the colleges, and hopefully we'll get to one conclusion.
Okay, okay. So, one last piece of advice to all the aspirants who are eagerly hearing your comments. What advice do you want to give out?
So the main advice is to follow the instructions of you people, because you are in this area for such a long period of time. And what I felt is the reading reading of all the books is not that much important, because at last you have to give, because 3 months earlier when I started preparing for this NEET SS seriously, so I felt that because I gave one GT and I got very bad rank in that GT. So I felt that what did I do wrong? Because in my mind I have read the entire Harrison. So what should I do right now? What should I do right thing in this point of time so that I can get a decent rank? So that's when I I started thinking about doing MCQs, and I started thinking about concentrating on the main point only, which are required for the NEET exam. Because many people used to think like that if you read entire Harrison, or if you read even the entire tables of Harrison, and if you do this, if you do that, then it will be enough. But at the end of the day, it is about MCQ only. So you need to prepare hard. Of course, you need to prepare hard for MCQs, and to remind all the to get memorize entire Harrison is not possible. So particularly focusing on little bit regarding NEET SS, it will be good for you.
Such an excellent message. I would want to make it in a concise form for the students. So the introspection at every point of your preparation is very important. You would want to identify your shortcomings, where you are lacking, where you are strong, where you are weak, and you will have to modify accordingly. So I once again request all the aspirants to give the grand test when it's actually due, so that you will get to know where you stand. Only if you know the lacunae, you will be able to compensate for that by Dr. Vikram, as Vikram Jain has told. He was getting not such a very good rank, so he started practicing more and more MCQs, and then his progress has become faster, and now here he stands with All India rank 24. So I think this interview would be a very very useful one for all the aspirants, and thank you, Dr. Vikram Jain, for sparing your valuable time And it's been a pleasure talking to you, and all the very best for you in the upcoming INI exam also. And I'm sure that you will come out with flying colors. So all the very best for your personal and
Thank you,
professional
sir.
life. Thank you.
Thank you, sir.